My name is Vikas Desai. I'm a urologist in Northwestern Medicine with a practice in general urology and a focus in reconstructive urology and urinary incontinence. Thought this would be an interesting opportunity to take time to discuss a case I saw of a 90-year-old female. She presented to me with urinary incontinence and particularly stress urinary incontinence, so incontinence or leakage of urine when she moved around, coughed, sneezed, and it was particularly troublesome to her as she was helping out with a local rummage sale, and she was on her feet all the time and kind of was really being held up in trying to perform her duties because she had to keep on finding a bathroom. And so when I talked to her, she was using 3 pads a day, um, and really plagued by this. She was 90 years of age and really wanted something that could get her back to her activities right away without any incisions or cuts. And so one of the things that's available is something known as a bulking agent, right? Bulking agents have been around for decades, and they kind of break down in two main forms: particulate versus non-particulate. And the problem was the bulking agents that were out on the market for many, many years were these particulate ones, which had side effects of erosion. And really the way they worked was they created a cushion in the urethra so you don't leak anymore. However, it would do that by creating a foreign body reaction. So it kind of caused a lot of side effects. So it kind of fell out of favor. And conventionally what's done for patients like my 90-year-old female is a urethral sling, which again is a great option, but does have some downtime in terms of recovery. And so this was a non-invasive option in terms of this non-particulate bulking agent known as Bulkamid, and it could get the patient back to her usual activities within just a day or two. And so it can be typically done under local or with a twilight anesthetic. And what it really is doing is putting cushions in the urethra in 4 locations to kind of create this bulking effect, right? It's a aqueous gel for the most part, and quite safe. So it doesn't have the same side effects as all these particulate options had in the past. And so I saw this patient, did her procedure. She was using 3 pads a day, obviously going into it. Saw her back 8 days later, and she was down to just 1 thin pad. And so great improvement in her symptoms. And I think a great option for patients who are looking for a minimally invasive, minimally restrictive in terms of time off, and to be honest, no incision option to treat their stress incontinence.